So, welcome everyone. Welcome to this edition of our Friday webinar, and welcome Mark Hyman,
Hi, Jim.
my dear friend. And it's always good to see you, and it's beautiful to see you on the screen today. It's been a while since I've seen your face.
Yeah.
So we're going to have a chance to talk about your new book, The Food Fix, and I'll give you a more formal introduction in a moment. But first, let's bring ourselves into this space. I know we're both busy people, like most of the people who are watching us. So let's take a couple of minutes just to breathe slowly and deeply, sitting comfortably. And everyone who's watching, please breathe with us. Just relax. And if it feels comfortable, let your eyes close. Breathing in through your nose and out through your mouth with your belly soft and relaxed. And remember, this is a concentrative meditation. We're concentrating on the breath coming in through our nose and out through our mouth, on the feeling of our bellies being soft and relaxed, and perhaps on the word soft as we breathe in and belly as we breathe out. Just relaxing with each exhalation. Thoughts come, let them come, let them go. Gently bring your mind back to soft belly. Okay, let's open our eyes, bring our attention back into the room, onto the screen. So again, welcome, Mark.
Thanks, Jim.
This is Mark Hyman. He's the founder and director of the Ultra Wellness Center, the head of strategy and innovation at the Cleveland Clinic Center for Functional Medicine, which you really set up.
Yes, right. Yeah.
You set up this.
Yeah. We started it in 2014.
He's a 13-time New York Times best-selling author, board president for clinical affairs for the Institute for Functional Medicine. He's a member of the Center for Mind-Body Medicine board and of our Food as Medicine faculty, and he's somebody whom I consult about my own healthcare program. So it's great to have you here, Mark.
Oh, Jim, thank you for having me.
So I wonder if you could give people a little idea about how you went from becoming a young man interested in medicine and doing a family medicine residency, and then how you moved into this incredibly powerful leadership role in functional medicine, and help our viewers understand what functional medicine is, and how you've been a powerful force in this revolution in nutrition and eating that is happening in our country and around the world. So who are you? Where'd you come from? How'd you get here?
I came from a little shtetl in Poland. No, I think the question is interesting because isn't the question really isn't how did I go from being a regular family doctor to doing functional medicine? It was how did I even end up in medicine, because I was always this, and I had to detour to go to medical school to learn family medicine. In fact, before I even went to medical school, I was focused on nutrition, alternative systems of healing, Chinese medicine, yoga, ancient healing systems, nutrition, and studied that at college, and really had a deep interest in the healing arts way before I ever thought of going to medical school. And it was sort of an afterthought after I left college. What am I going to do with my life? And I thought, well, okay, I'll try medical school, and it seems like a good thing to do, and I can be of service and use some of the things that I'm interested in. But I literally went through medical school in order to be able to do what I'm doing now. Although I didn't really know about functional medicine, I knew about alternative systems of healing and integrative health and medicine and ancient systems of healing. And so I was very, very interested in that. Read books like Nutrition Against Disease in college by Sir Roger Williams, and Mind is Healer, Mind is Slayer by Ken Pelletier, is a friend of ours. Began to really think about these things deeply. And I got sidetracked as a family doctor. But once I came to my senses in my mid-30s, I was like, well, I don't really want to do this regular medicine anymore, because I just seem to be putting a Band-Aid on everything. And I used to be in the ER having an exercise in my head, which was there something that patient did that they could have avoided or prevented that would have prevented them from getting into the ER, right? Something they ate or their lifestyle, or, even in the most extreme situations, there was usually some reason that they had control over that they weren't aware of. And then I got a job as the medical director of Canyon Ranch, where I was able to fully experiment with functional medicine. And I was forced to, because I got sick. And like most people in our space, it was some trauma or sickness or something we're trying to figure out and fix. And traditional medicine wasn't cutting it. So I literally had to reverse engineer my way back to health using functional medicine. And then I realized this was a very new field. And I thought it was pretty well established. And I became on the faculty teaching, and I became the chairman of the board. And so long story short, I really have spent my life trying to be a spokesperson and an advocate for a new system of thinking about health, which is functional medicine. It's essentially the science of creating health as opposed to diseases. It's about treating systems. It's about getting to the root cause. And so that really is what led me to do this. And so really an accident. It wasn't because I was trying to become a leader. I just had this tremendous passion to understand the way the body worked, to heal myself and my patients. And I began to see miracles every day and go, wow, this is disturbing. If these patients can be healed from dementia and autoimmune disease and chronic fatigue and diabetes and Alzheimer's and Parkinson's and digestive issues and depression and autism and ADD, and these methods were working, why weren't they out there? Why didn't people know about them? Why were so many people suffering needlessly? And that was really what drove me to do everything I do, to write the books, to tell the stories, to travel like a maniac like you, although we're stuck at home now, which isn't so bad for my health personally, to not be on the road so much. But it's really been my mission to sort of end needless suffering through the power of functional medicine, the power of community, and in order to help us change our behavior and our social environment.
I want to focus in a minute on functional medicine, but I want to highlight a couple of things you said. You asked it before we began, who's watching? Well, a number of the people who are watching are younger people who are wondering, what career can I get into? How can I be helpful to people? And so that was very much a part. You were very much in this world of exploration before you went to medical school. And then how was it for you? And you have any words of wisdom about going through medical school when you already had this broader perspective? How did you bring yourself through that experience? What was it? What kept you going?
Well, I think it was because I knew differently that I was able to actually be in it and take it for what it was. And I remember very consciously saying to myself that I was going to just swallow the whole sandwich and not question it while I was in it. So I became an expert in it. And then I was able to sort of use that expertise to sort of change the paradigm. And I was very deep into yogic practices and meditation and yoga and exercise, and so eating well and healthy. So that's really how I got through medical school, and really with a lot of self-care and attention, and I was able to actually really thrive. I enjoyed it, and I found the body just this fascinating story. And I think what medical school does very well is teach you all the piece parts. So you learn all the reductionist views that help to dissect the human biology in a way that we can understand, but it never was put together as a coherent story. It was all reductionist and disease based, and it wasn't understanding ecosystems and functionality and the dynamic nature of our biology and the interconnectedness of everything. And now with the advent of a modern science and systems biology, we're blowing apart these concepts of disease, which is why we see the microbiome as an example, blowing apart our notions of illness. I mean, how can you do a fecal transplant on a kid who's autistic and the kid gets better, or a fecal transplant on a diabetic and their diabetes gets better? Or how does the microbiome affect cancer, heart disease, dementia, autoimmune disease, obesity, and everything else? It doesn't make sense given our paradigm, because you don't go to the psychiatrist and he doesn't say, well, let me look at your stool and see how your microbiome is, if that's causing your depression or anxiety. But that may be where we need to be looking. And that's what functional medicine does. It gives us a framework or a story. And that's really what allowed me to sort of emerge from that reductionist view.
Tell us about, in a sense, what you've taken as a very in medicine, conventional medicine focuses very narrow on diagnostic entities. The story is kind of limited and somewhat cut and dry. You've been able to tell through functional medicine, both as a practitioner and in your writings, a bigger story. So give us a sense of what this bigger story is.
I mean, what is functional medicine?
Yeah, exactly. Because it's a word that people use a lot, and people say, I'm a functional medicine doctor, and I'm not so sure when I see some of those people. I know you and I know others who are on our faculty who do see the big picture, but others, it looks to be like sometimes functional medicine is just bringing the narrow biomedical perspective into a slightly different realm. So
it's sort of like Christianity. You have Jesus saying love everybody, and then you have the Crusades, and they don't quite go together. So in the name of functional medicine, people may be doing things that aren't quite that. For me, it's a system of thinking. It's a theory of medicine, which we've never had before. We've had a lot of reactionism. You have a headache, you go to the head doctor. You have a joint pain, you go to the joint doctor. You have a stomach ache, you go to the stomach doctor. But that is actually not the way the body is organized. And functional medicine provides a sort of a meta framework of understanding human biology as an ecosystem that's interacting with a larger ecosystem in which we live, in terms of the environment, our food, community, toxins, and so forth. And when we look at disease and health through the lens of systems, we begin to understand that health is really an imbalance in a number of core systems in the body that have to function well in order for you to be healthy. Your gut, your immune system, your ability to produce energy in your cells, your detoxification system, your transportation, circulatory and lymph systems, your communication systems, hormones, neurotransmitters, et cetera, and your structural system. And those are all influenced by your lifestyle, by environment, by genes, and your mind, body, spirit. And that whole mess, if it's working well, is health. And if it's not, it creates disease. So the job of a functional medicine doctor is to really understand the dynamic functions of each of these systems, understand how to diagnose imbalances and how to correct them. And when you correct those and treat the root cause, disease goes away as a side effect. You don't actually treat the disease. So just as an example, a patient that sort of might help illustrate this was a 50-year-old woman who was an executive coach, and she was overweight, pre-diabetic, depression was severe. She had terrible irritable bowel syndrome and reflux, and she had psoriatic arthritis, which is an autoimmune disease. And she was on medications for depression. She was on a $50,000 drug for her autoimmune disease. She was on medicines for her reflux. She was on sleep medicines, and she was really struggling. And what really was going on was she had diseases of inflammation. These are all, depression is inflammation of the brain. Psoriasis is inflammation of the skin. Psoriatic arthritis is inflammation of the joints. Irritable bowel is inflammation of the gut, and so forth. And so we basically took out the inflammatory foods from her diet. We corrected her. Well, she had bacterial overgrowth. The acid blocker tends to promote that. She had yeast overgrowth in her gut, and so we cleared out the bad bugs in her gut and fixed her microbiome by eliminating irritating foods, putting in whole foods and anti-inflammatory foods, and we gave her some probiotics, vitamin D, and fish oil. And within 6 weeks, she came back, and we didn't treat any of her diseases. We just treated the systems. And within 6 weeks, she came back. Her psoriatic arthritis was gone. Her skin was clear. She was off her meds. Reflux was gone. Irritable bowel was gone. Depression was gone. She lost 20 pounds. She was sleeping well. So you don't treat the diseases separately. You treat the system. And when you do that, you see miracles. But they're not really miracles. It's just good science, understanding the nature of human biology. And we really have gotten it all wrong in traditional medicine.
It makes so much sense. And this is actually the perspective of the traditional healing systems, although they didn't have the science that we have and the kind of tests, but they understood all these interactions, and they were looking at function and looking at systems, and we forgot that.
Yes.
And as somebody who has brought this work out into the world, both in terms of educating physicians and other healthcare professionals, and also writing, how do you see things have shifted? And what do you see the resistance is now? Because it's so clear. Once the way you stated it, just in a couple of minutes, just kind of opens up the whole picture. And of course, it makes sense. Mm-hmm. Why not treat the underlying processes and understand the interrelationships? So why is it so difficult still for this approach to come forward? And what do we need to do to make it more widely available?
Well, there's still large groups of people who believe that climate change is a hoax, that the Earth is flat, that that evolution is a theory but not reality. So, even though we have scientific proof over decades, even 100 century for scientific theories, it takes a long time to overturn them. And Max Planck said it very well. He said you don't convince your opponents by helping them see the light, but because a new generation grows up in their place.
Science advances funeral by funeral.
One funeral at a time, one funeral at a time. So there are those fossils, but I'm in a place like Cleveland Clinic where there's remarkable openness and curiosity. When we see physicians who are at the peak of their learning and understanding, who really understand and are keeping track of the advances in science and systems biology and the microbiome and the genomic revolution, they can't help but understand that there are these common linkages like inflammation or mitochondrial dysfunction or the microbiome and so forth. So I think there's this growing understanding among really top scientists and physicians that this is the future. The problem is that medical school and medical practice and medical reimbursement all is driving us to practice the old model of medicine. So we're kind of stuck in a model of medicine that's based on reimbursement but not evidence. And I think that's the challenge we have now. And I think if we are able to tell the story in the right way, if we're able to demonstrate the evidence slowly, bit by bit, which we're doing at Cleveland Clinic, we have a number of studies in for publication now. We published a comparison with a family practice last fall, which showed better outcomes than a traditional family practice at Cleveland Clinic. So we're seeing the beginning of a literature base specifically on functional medicine. There's a lot of data on all the piece parts, right? On diet, on lifestyle, on various aspects of functional medicine, but really looking at the system as a whole, we're starting to build that database. So I think that will help, but science doesn't necessarily convince people. I think if you look at our country today, you see there's the whole mask issue is just staggering to me. I mean, every other country is clear that masks are sort of useful and helpful, and it's just common sense. I mean, if you had the flu, would you go into a room, a bunch of people, and start sneezing all over them? No, you'd cover your mouth. If your surgeon is going to the operating room operating on you, you don't want him to cough all over your wound, or he wears a mask. It's okay. So I think we just have this anti-science bias now in America, which is really frightening.
So you think there's an anti-science bias within the medical system itself? What do you mean?
I think there is, in a sense that we're really at this verge of this tremendous paradigm change in medicine, and it's very hard to get people to change paradigms. I think this is, the structure of scientific revolutions by Kuhn. Basically, was really a brilliant book that talked about the resistance of science to change and how it takes decades and decades for discoveries to be actually implemented into practice. And we see that in medicine every day. We see, it takes decades before we actually start to change our practice of medicine. But I think that there is an inherent lack of openness, and what happens is that there's this term in medicine that people use called evidence-based medicine, and that term is used as a smokescreen to undermine any new ideas and to challenge anything that threatens the status quo. And what?
How
Yeah,
does
and
it?
I think if you look at what we're doing now, whether it's polypharmacy with any patient, there's no evidence that that's safe or effective. Now, even vaccinations, which is a touchy subject, each vaccine may be studied alone, but if we give 20 or 30 vaccines to a kid, that's never been studied. Is that an evidence-based intervention? So we don't actually have an honest and straightforward conversation about the lack of evidence for many of the things we do have as standard of practice in medicine. And we are closed to ideas that seem to be new or innovative because their quote is lack of evidence. But there's abundant evidence if you look at, for example, lifestyle, diet, exercise, sleep, meditation. There's no lack of evidence that these things are effective. And safe. Dean Ornish once said, which I thought was very funny. He was talking to the American Heart, Lung, and Blood Association about his program, and they're like, "Well, we want to make sure this is not dangerous and it's safe to do." And he goes, "What do you mean? You're eating vegetables and exercising and meditating and doing yoga and talking to people in a group? Is that something you need to prove is safe?" I think that's sort of sometimes what we come up against.
Yeah, there's so many interesting things about this. One of the ways that people do change, and you mentioned this about yourself, is when they themselves, physicians, when they themselves become ill and conventional medicine doesn't work. And I think you have a number of physicians in your practice, and you've seen them over the years. Do you want to say something about that? I found that to be a very important way of opening up the medical mind.
Sure. I mean, when you or someone in your family has something that traditional medicine isn't working for, they start looking out everywhere else. And I have so many physicians in my practice who get it. And it's actually gratifying to me to see that there is an increasing openness among many, many doctors. So, I was just with a colleague of mine who's the dean of Tufts School of Nutrition Science and Policy, and he's very interested. I mean, very open. He gets food as medicine, and he understands these concepts. And the people who are the smartest people out there, who really understand the literature, who've been reading and seeing the science, they can't deny these stories anymore. They can't deny that food is inflammatory, that food causes diabetes. They can't deny that it's linked to so many different things because the data is there.
One of the things that we're finding about our work and training people, we have our food as medicine training, but also the mind-body medicine training, is that when people are anxious, under stress, in chronic fight or flight, their minds tend to be more closed. And I'm wondering this is something that I've observed, is that one of the things about physicians and other healthcare professionals is they're so stressed out that it's like they don't have the flexibility to open their minds to new possibilities because of a level of stress and anxiety that they're feeling.
It may be true. It may be true.
So it's very important. And the way we work and the way we work with you also is bringing together those two, helping people to deal with their stress at the same time that we're teaching them about this new medicine, functional medicine, and the use of nutrition. So it seems like they go hand in hand. We have to change our consciousness, and we have to come into a kind of new biological and psychological balance in order, many of us, to appreciate what the possibilities are.
Absolutely.
Now, I remember, I don't even remember how many years ago, you'll remember, when you were considering going to Cleveland Clinic. I remember we were sitting having a cup of coffee or a cup of tea, and you were saying, "I'm wondering if I should go to the Cleveland Clinic and do this. They've invited me." So it's an extraordinary story, and I think an extraordinary opportunity to move medicine ahead. that you've been offered because of your experience and what you've written. Can you talk a little bit about what's happened at Cleveland Clinic and what the promise is there?
Well, I think, it's a massive organization, and, it's really all about innovation. It was one of the leaders in innovation for many, many things that are now standard of care, different kinds of heart surgeries, valve surgeries, breast surgeries. And they've always been at the forefront of doing things a little bit differently because they're not a traditional academic institution. They're a clinic. They're focused on patients first, on clinical care, and they have a robust research program. But they really are all about innovation and collaboration. So it's a very different culture than many other institutions. It's not about, there's no competition between departments. Everybody gets a salary. Everybody's got a year-to-year contract. And everybody is really very smart and very open and curious. And now there are a few people there who are fossils, as the former chief of staff called them, who basically are challenged with new ideas and like to stick to things the way they are, which I understand. But for the most part, everybody I've interacted with there is curious, open. Some are like, wow, this is great. What took you so long to get here? And many are, this is really, I get it. I get the big picture. Let's look at this together. Let's study things together. Let's do research together. Let's do programs together. And it's just so gratifying to see that at Cleveland Clinic. And we've been able to move forward on a lot of fronts in community-based programs, on shared medical appointments, which are group visits, which are extremely effective. We call it Functioning for Life, that bring people in a 10-week program and guide them through experiences. And we're going to be publishing data on that soon. And we just see tremendous benefits from this. So I'm very encouraged by the level of curiosity and openness within the clinic and the support we've gotten.
And what kinds of results are you seeing? I remember there are a whole lot of it. Last time we talked about it, there was a big waiting list of people to come.
Yeah.
Starting to get some very interesting results. Can you talk a little bit about?
Sure.
Because not only is it a kind of exemplary, but it's potentially it's a model for other people.
Yeah. Well, I think we've been sort of, in a fee-for-service model. Functional medicine is a challenging model because, it requires a lot of time with people initially, but, you treat them and you heal them, and then they don't become these chronically ill patients that are draining the system. So there is a bit upfront in terms of the effort, but the payoff is huge. And what we've seen, we published, one study comparing our outcomes. And when I got there, I was really clear. The reason we're there is not to have another clinic at a big medical center and have a little, star in their back, a gold star, which says they have some kind of alternative or integrative program. But it was really to be an agent of change within value-based care and demonstrate that we can produce better outcomes at lower costs for chronic disease and scale that in the organization as well as in community-based programs. And that's really been the goal and our focus. So we've done this through tracking what we call PROMIS scores, which are patient-reported outcome measures. That is a National Institute of Health validated metric for assessing patient outcomes, and is correlated with hard outcomes very well in other studies. So it's a very well validated tool that is right up there with RCTs in terms of its validity. And we found in our initial study where we took 1,000 patients who've gone through our program and compared them to a larger cohort at a family practice within Cleveland Clinic, that we actually performed better and had better outcomes over time, which is great. And then we just are publishing a study that's been accepted. It's not published yet, but it's been accepted for publication on autoimmune disease, rheumatoid arthritis, psoriatic arthritis, comparing it to the top rheumatologists at one of the top institutions in the world for autoimmune disease. So they're doing a fantastic job. And we still perform better in terms of pain and outcome measures in terms of functional medicine. And that's coming out soon. Then we have another study that's up for publication, which is on shared medical appointments, or the Functioning for Life, which has shown, which was really interesting to me. We compared hundreds of patients who went through the program with a matched cohort who went through a one-on-one visit with doctors within our own center. So we already know the center performs better than traditional family practice. But we compared groups to our traditional one-on-one visits. The group visits were almost 3 times more effective and much more rapid improvement in outcomes than the one-on-one visits, which is interesting. And you know this, Jim, because you've been running groups forever. It's a much more powerful way to engage people, to educate people, to get people enrolled, to get them to change their behavior, and to make lasting change. And they do it because I call it the love diet. It's the power of connection and community, along with the right information and change in diet. And you combine food as medicine and community as medicine. and you have remarkable success. And that's what we see. So I'm excited about that.
You know, what I'm going to ask you to do is to send me some of these papers. I'd like to put them up on our website, make them available.
Well, there's only one so far that's out. The rest are in process, but we're pumping more through the pipeline. So it's pretty exciting.
It's so important that you're doing the model program and doing the research. I want to shift two more topics I definitely want to cover. One is, we'll come to toward the end of our time together, is your new book and some of the policy prescriptions. But what about prescriptions? I know functional medicine is very individualized, but what about general guidance for people during this COVID-19 pandemic? What are you suggesting? Your sound went off for a sec. I don't know if that.
That's an interesting question, because there's an interesting statistic that I recently read, that there are more cases of COVID-19 in the White House than there are in Taiwan, Vietnam, and New Zealand combined. and I think the question is, why are other countries not so adversely affected? Some of it's because of how it's been managed, but also to do with the fact that in Vietnam, for example, there's a 1% obesity rate. In America, there's a 42% obesity rate. And so we have the pandemic of COVID-19 meeting the pandemic of being over fat, which is 88% of our population. And that means that they're metabolically unhealthy. They have high blood sugar, high cholesterol, high blood pressure, they have belly fat. These are signs of poor metabolic health. And when you have poor metabolic health, the fat that's around your belly, even if you're thin, by the way, because 75% of us are overweight, but 88% are metabolically unhealthy, what we call skinny fat. We're thin on the outside, fat on the inside. And that fat on the inside is inflammatory. It's producing all kinds of these cytokines. You've heard about these cytokine storms. And these inflammatory cytokines prime your system to be ready to create a fire. And so we see with COVID-19, it's like putting gasoline on a fire, it blows up. And that's why we see people who are overweight or obese 3 to 12 times more likely to get sick or die, people with chronic disease, which is also inflammatory, or even being elderly, which is also inflammatory. In fact, aging has been called inflammaging. So I think that we really need to focus on the idea that our diet is really causing us to be more vulnerable, one, to getting sick, and two, to actually spreading the disease, and three, to getting really sick and dying. We know that if you're overweight, for example, the vaccine doesn't work as well, that you're spread the virus longer, that you're less likely to respond to therapies, that you're more likely to get very sick or die from, for example, influenza. So we know that we're in trouble as a society. So now more than ever, it's important to double down on metabolic health. And it may have taken you decades to get metabolically unhealthy, but can only take weeks to get metabolically healthy. For example, if you look at a recent study on gastric bypass, we used to think that it was some magical thing that happened as you stapled the stomach and changed the gastric hormones that led to this dramatic change in metabolic health and weight loss and reversal of diabetes in 2 weeks. But when they compared doing a gastric bypass to simply putting people on the same type of diet that they would if they'd had a bypass, there was no difference. It wasn't the stomach surgery, it was the food. And by changing the food to match each population, they literally reversed the diabetes in a couple of weeks. So whether you're 400 pounds or 300 pounds, it's not necessarily the weight, it's the quality of your diet that changes your metabolic health very quickly. And of course, eventually you want to get the weight off, but you can really quickly change your metabolic health by eating a whole foods anti-inflammatory diet, or what I like to call the pegan diet.
Vegan means?
It's a joke. Basically, it's a joke between paleo and vegan.
Everybody else.
So, I mean, I was on a panel once with two friends. One was a cardiologist who was a vegan. One was a paleo doc, and they were fighting. And I'm like, "You're paleo, you're vegan. I must be a pegan." And everybody laughed, and I said, "Okay, that's funny." And then I started to think about it, and they had way more in common with each other than they did with the traditional American diet, right? They agree about everything except for where to get your protein. Beans and grains or animal food. Everything else is the same. No junk food, no sugar, processed foods, more vegetables, fats, nuts, seeds. It's all the same. Even they both say don't have dairy. So I began to think about, what are the principles of a whole foods diet and healthy nutrition? It's based on science. It combines that with common sense. It's broad enough to be inclusive for most people. And how do we have an aspirational diet that follows a certain set of guidelines and principles? It's not rigid. And that's when I sort of came up with this concept, and I've written about it, and I've got a book coming out about it in February 2021. So you can stay tuned for that.
And it's great because there's a kind of ecumenical embrace. You're not getting sort of stuck in any particular pigeonhole in this camp or the other camp.
What do they say? Don't let your dogma run over my karma or something.
Yeah, exactly. Well, it's your karma over your dogma.
Karma over your dogma, whatever, something like that.
So, what about, you're talking now about obesity, metabolic disease, and how that predisposes us to COVID-19 and makes
Yes.
cases much worse if we do contract the virus. In your most recent book, in The Food Fix, you're taking an even bigger perspective on and sort of putting food at the center of a potential revolution in how we live and how we deal with the environment. Could you tell the folks who are watching us about where you are with that perspective and what they need to know, what could be helpful to them in thinking about this bigger picture and how food plays into it?
Well, just to get a little background on why I wrote this book. It's called Food Fix: How to Save Our Health, Our Economy, Our Communities, and Our Planet One Bite at a Time. And it brings together a lifetime of understanding of the intersection of a lot of different global issues that are connected by food. It's the nexus where it all comes together. And as I began to think about why my patients were sick, it was very clear that most of them, it was either predominantly or mostly by the food they were eating. And then I began to ask myself, as a good functional medicine doctor, why? Why are they eating the food they're eating? Well, then I began to think about that. And it was because of our food system that produces poor quality food. And I'm like, well, why do we have our food system? Well, it's our food policies. And then why do we have our food policies? Well, it's our food industry that's influencing those policies. And then I began to really dig into the whole network of intersections of these problems. And just to sort of explain it a little bit, it's really clear that 80% of our healthcare costs are related to chronic disease. And most chronic disease is caused by diet, whether it's diabetes, heart disease, cancer, not all cancers, but most cancers, especially the common ones, kidney failure, hypertension, Alzheimer's, depression, and more. They're all related to our diet in one way or another, some more than others. And that is creating enormous burden to society, where 6 out of 10 of us have a chronic illness, 4 out of 10 have more than one. And as I said, 80% are metabolically unhealthy. Then the economic burden of that is staggering. Someone sent me a statistic that, I think the largest company in the world is sort of Walmart, and has an annual revenue and budget of like $500 billion, and Medicare is 1.3 trillion. So if Medicare were a company, it would be the largest company in the world with the largest operating budget. And it's because of this burden of chronic illness. And it's 1/3 of our total federal budget. So the economic implications are staggering. Then there's the social implications because of health inequities related to what we see in African American, Hispanic, Native American populations that are all ravaged by diet-related diseases. And we see that at COVID, where there's communities of color, they're 30% of the population, they're 70% of the deaths, which is really unconscionable. And it's large part because of the food and other social determinants of health. And then, so we've got sort of food racism in a sense, or structural violence in the sense of structural racism in the food system. And then we've got effect on kids and their cognitive function. Their ability to have academic achievement is impaired because of the poor quality food and nutrition. That's well documented. The CDC put out a report on nutrition and academic performance. It really outlined all this very clearly. We have national security issues because 70% of the recruits for the military are rejected because they're unfit to fight. And then lastly, and very important, is the environmental and climate consequences of our food system. Most people don't realize this, and I certainly didn't, but our food system as a whole, from end to end, whether it's deforestation, soil degradation, soil loss, which stores carbon, factory farming, food waste, transportation, refrigeration, all the food system is the number one cause of climate change, more than fossil fuels. It's also the biggest driver of environmental destruction in terms of loss of biodiversity. We've lost half of our bird species in this country because of agriculture, 75% of our pollinator species, 90% of our edible plant species, 50% of our livestock species are gone, and fisheries are depleted all over the world. So we're seeing massive destruction as a result of the agricultural system and the agrochemicals that are used, the nitrogen fertilizers, the pesticides, herbicides, all that's destroying the environment. So we have this kaleidoscopic, set of problems that all seem different, separate, and individual. I mean, how does kids' poor academic performance connect to climate change, connect to the economy, connect to social injustice, It's all one problem, and it's all connected by the food system. And if we fix the food, it's like a root cause analysis. What's the root cause of someone like that patient I was talking about? What's the root cause of all these problems? It's the food, or to paraphrase President Clinton, it's the food, stupid. So we have to work on solving the food crisis in this country and then globally.
As I was reading The Food Fix, and what I saw is, once again, just as you have functional medicine, you've expanded the narrative. You've told the bigger story of the role with food as the central character in the story. And it was, on the one hand, it was illuminating, and it gave me a sense of, okay, I'm understanding, and you're very good about bringing in the evidence for these different statements that you're making. So I'm understanding the connections a bit better, and so I felt reassured that I had the big picture. And then the question is, for me and every other reader and all of us, what to do. So,
so the book is not called Food Apocalypse. It's called Food Fix. Although there's a lot of depressing stuff in there, there's also a lot of hopeful stuff. And I talked about what's happening with community-based solutions and grassroots efforts that are being done all over the place, about innovations in business and even policy changes happening. And they also outlined in there a number of different solutions on a citizen level, business level, philanthropy level, and also policy level that need to happen in order for us to really move things forward. So what are the farming and agricultural policies we need? What are the policies in Medicare and Medicaid? What are the policies in our dietary guidelines? What are the policies in food stamps? What are the policies that have to do with the social injustice issues around food and equity and health? What are the policies around how we pay for different types of services with Medicare and Medicaid? Should we be paying for food as medicine? We know that you could save 80% of healthcare costs by giving people food instead of drugs to reverse their diabetes, and yet we pay for the drugs and not the food. And we'll pay literally almost $250,000 a year for drugs for a patient with diabetes, but won't pay a few $1,000s for food for them a year, which will fix the problem. And it's been documented. So when you say, we don't have an evidence-based system, that's what I mean. We have clear evidence that food is a solution, but we don't have any mechanism in healthcare to pay for it.
Okay. I want to take a couple of examples to help people who are watching us to see what kind of guidance. So, for example, your kids are in a public school system, or private school for that matter. What can you do? How can you enter into this picture that you paint? So
well, I think there's something on my website. It's called foodfixbook.com. There's a free guide called the Food Fix Action Guide, and it has 20 different suggestions for individual action and multiple suggestions for business and policy changes. So that's a great place to start on ideas. But I'll just give you an example. There's a friend of mine, Jill Shaw, in Boston, who saw the challenges in the Boston City School District and the horrible lunches these kids were eating, the poor academic performance, the poor behavior, the attention deficit issues. And she determined that, these kids were eating highly processed food that was made in another state, that was shipped in, frozen, packaged in plastic, and reheated in a microwave. And she said, what if we could create a model where and she was a philanthropist, so she had a little bit of money, but it wasn't very much money. It was like $65,000 to refurbish a kitchen. And she created a demonstration model, which was putting in real kitchens with ovens and places to cook food, not just deep fryers and microwaves, hired top chefs to create delicious food that kids would eat, that met the school nutrition guidelines and was within the school nutrition budget for school lunches, which is not very much. So it's not an easy feat. And she was able to demonstrate this and then scaled it through all the schools in Boston City School District. It's just an example of what one person can do if they want to make a change. And now she's partnered with the mayor and others and is trying to scale this across the country. There are other places like Conscious Kitchens, which is a great resource for people who are parents and have kids in schools on how to get their schools to actually transform their food. So wherever you are, whatever it is you're doing, whether it's simply just improving the quality of the food you buy, whether it's starting a little compost pile in your backyard, whether it's starting a little garden or a community garden, whether it's working with your local policymakers in your town to create a compost ordinance like they did in San Francisco, or whether it's working on a national or state level to elect leaders who care about these issues. And there's a great group called Food Policy Action. You can go to foodpolicyaction.org, and they rate all of your congressmen and senators on their voting records, so you can actually see what they're doing and call them out or call them. Or if
So
you don't like what they're doing, you can vote them out.
So people, you can look in the food fix. You have a lot of that information is there, and say what the address is, the online address to find out this.
Foodfixbook.com.
Okay, great. Now, one of the things, Mark, and we've worked with Eskenazi Health, and in addition to training more than 300 people now in mind-body medicine, we also completely restructured the food in the hospital. They were buying everything.
Yeah.
And they've quadrupled their income from food. At first, the food services people were saying, well, nobody's going to eat this food. Everybody's used to eating fried food. But when they had the kind of food and the kind of diet that you're describing, everything changed. It changed for the food services people, and it changed for the patients and the family members and the staff who were eating in the cafes, and it made a profit. So that's very hopeful. And I think it's another kind of model. The other thing I want to just emphasize from what you said, which is what I was responding to, is when you actually do something to make a difference, when you enter into this landscape and you begin to cultivate parts of it in ways that are healthy, it feels so good personally. You don't feel so overwhelmed by all the forces that are around us that are threatening our health and well-being. So I really want to tell you again, I really appreciated that about Food Fix.
Yeah.
I want to ask you now, where are you going? You're moving more and more into this whole area of policy and this big picture. What's next for Mark Hyman?
Gosh, that's a great question. I'm like everybody else, we're in this kind of holding pattern of COVID. We're in this holding pattern politically right now. I don't know when this is going to air, but we're before the election, and so there's a time of great uncertainty and instability. But there's a great line, and I have it in the book from Common, who's a rap singer, who said, where are you going to put your one grain of spiritual sand on the universal scales of humanity? And that's what I think about every day. Where can I add a little bit of light or a little bit of goodness wherever I am and whatever I'm doing? So I'm working on this vegan diet book, which is coming up. I'm going to be spending the winter in a little bit of a retreat, writing a different kind of a book about sort of not exactly a memoir, but sort of a lessons learned throughout my life, and how did I sort of get to be here, and what are the little notes from God that come through your life that help guide you toward the truth. And so I'm excited about that. And I, of course, working with Cleveland Clinic on all various projects that we're doing that are pretty exciting, and continue to do the research we're doing there, and running my practice, and trying to do things like this to help spread the word.
No, it's great. And one of the things I really appreciate about you is that you are so committed to spreading the word. You're a writer. You come by that partly genetically, or family, right?
Yeah, my mother was a writer and an author. My father was a journalist, and he wrote a little book on Barcelona, which is where I was born.
So, and clearly writing is so much a part of you, and the communications and the reaching out to people, which is so important. And I want to encourage people who are watching us, you may not have Mark's skill and fluidity with writing, but it's so important to be communicating what you're experiencing to other people. And I really appreciate that for you, and your willingness at times to really say, okay, I'm discovering this and I'm going out on a limb and it looks really good. And you're putting yourself out there, and you're willing to take that kind of chance.
Yeah.
And it's just as you were as a kid before you went to medical school, right? You're kind of.
I have a very rare medical condition. It's called ODD. It means I'm odd.
So I want to thank you. I want to thank you for being on this program. I want to just thank you for being part of our work at the Center for Mind-Body Medicine, and for everything that you're doing, and for being my friend.
Thank you, Jim.
It's always a treat.
So one of the great blessings of my life to call you my friend. So thank you.
Thank you. So we're going to close just with a couple minutes of meditation, and also I just want to indicate that your two kids, they picked up on it. One of them's in medical school, right, and the other is a chef.
Yes. My daughter just got into medical school.
And I think one of the influences, and I want to say this to people who are watching, is I love being with you in your kitchen.
Yeah,
Not only do you make delicious food, but you obviously have a really good time doing it.
I do. I love cooking.
And you communicate that not only in the kitchen, but in the books and when you're talking, that it is a labor of love, and it's a labor of joy. You're bringing
Yes,
joy to this whole
totally,
process of being
totally.
a doctor and educating people. So
Yes.
thank you. Let's take a
Thank
minute
you.
or so to breathe together, and then we'll close this session. Just relaxing, deep breathing in through the nose, out through the mouth, with your belly soft and relaxed. As thoughts come, let them come, let them go. Gently bring your mind back to soft belly. Okay, open your eyes, bring your attention back in the room. So, thanks again, Mark. See you soon. Take care.
Thanks, Jim.